Our service offers therapy for people with depression and anxiety. We see a whole range of different problems in the service, such as PTSD, panic disorder, social phobia, and OCD. In fact, it's not essential to have a diagnosis, and we see people with problems such as low self-esteem, worrying excessively, or feeling stressed. Our service tends to work with people with mild to moderate severity problems because the treatments we offer are short-term and can vary from just a couple of sessions to weekly sessions over a few months. To start, we offer a suitability assessment. This usually takes place over the phone or online to determine if we're the right service for people, what treatment they need, and how many sessions they require. One of the main sorts of treatment we offer in the service is CBT, which stands for Cognitive Behaviour Therapy. This therapy looks at how people's thoughts affect the way they feel, because problems like depression and anxiety can make things seem more negative than they really are. The actual treatment can look very different from one person to the next, but the sort of thing we might ask people to do is to keep a diary of their thoughts, or we might ask them to increase their activity levels, or we might get them to test out their thoughts and beliefs in an experiment to see if they're an accurate reflection of reality. Wanting to change is really important, and people should be prepared to do some homework in between sessions. There are a range of other types of treatment available, but there may be some variation across the service. We offer therapy both in person and remotely via video conferencing or telephone. We do have some access to group therapy too, and various digital treatments. There are lots of possibilities, and we'll try to find the best one for you at your assessment. If we don't have the right option, we will try to signpost people to the best available support. Treatment is very much tailored to the individual and their goals. We also ask people to complete questionnaires after each session to monitor progress, so we know if people are improving or not. We also specialise in treating individuals with certain long-term health problems, particularly cardiac and respiratory issues, diabetes and chronic pain. We know people experiencing problems such as these are 3 times more likely to be depressed or anxious. We're also keen for people who are aged 65 or over to access treatment if they're experiencing problems with their mood. Age should never be a barrier to accessing treatment. We see people in person at our bases in Cambridge, Huntingdon, March and Peterborough. We also see people in GP surgeries and other locations in the community. All the information is confidential, but we do keep in contact with GPs, and you can discuss any concerns with your therapist. We know therapy can be a daunting experience for people, so we try to make it as relaxed as possible, and many people find the experience life-changing.